Good morning and namaste. I'm Dr. Prenaza. Hope you had a great night. I know you had a great night, but there are few people who face sleep disorders in life. And in lifetime, we spend one third by sleeping. But there are people whose main problem is sleep disorders. And there are many disorders like insomnia, parasomnia, hypersomnia, breathing related sleep disorders like obstructive sleep apnea, central sleep apnea, kind stroke breathing disorders, and then circadian rhythm sleep disorders, sleepwalking, which is also known as somnambulism, nightmares, night terrors, and many other. But today I'll talk about the insomnia. If there is disturbance in quantity and quality of sleep, having these three features, one of these features like difficulty in initiating sleep, difficulty in maintaining sleep, and early arousal of sleep, and difficulty in going back to sleep, then you might be having insomnia. So for this, what we can do? The treatment for this can be pharmacological, and there are other treatment like sleep hygiene, how to maintain, and then sleep restriction therapy, and then relaxation breathing therapy. So I'll not tell you right now about the pharmacological therapy because you will not get it in over the counter, but I'll definitely tell you about this, how to maintain the sleep hygiene, and about the relaxation therapy. So to maintain the sleep hygiene, first you should do is, there are do's and don'ts. So do not go to bed or take nap during daytime. Do not use your bed for any other purpose rather than sleeping at night. Like, do not eat in bed, do not take nap in bed, do not read in bed, do not watch television by sleeping on bed. Just leave alone the bed during daytime so that only you can use that bed while sleeping and you'll get sleep properly. Second, do not use any caffeine containing drinks or food before going to sleep. Thirdly, do not do exercise just before going to bed. Fourth, do not use substance like alcohol and smoking before going to bed. Do not take heavy meals before going to bed. If you are worrying for something, write it in a diary, keep it close, and solve it early morning. Don't worry about that and sleep at that point. Do not see clock time in again and think that I have been sleeping since an hour and I have not slept yet. Do not think so. Do switch off the light while sleeping, because there is a hormone called melatonin which gets secreted from our pineal gland, and what happens is that hormone gets secreted only in the darkness, and if we switch off the light, the secretion of melatonin gets decreased, which helps in the better sleep. So switch off the light, it is very important. So now about the relaxation breathing therapy. For this, what we can do is, there are 5 steps which we can do 20 minutes for 2 weeks. If you are used to with that, you can go up to 30 minutes also. There are 5 steps. First step, sleep in the supine position. Take a breath from nose or mouth, whichever is easy for you. Second, take a deep breath and concentrate on abdominal breathing more than your chest breathing. Thirdly, after every in and out 1 cycle, that is inspiration plus expiration equals to 1 cycle, pause for a second and evaluate your breath, thinking, was it smooth? After a while, it will be uniform and smooth. Fourth step will be, concentrate on the air that is coming in and out. Like, prefer the place where you can feel air properly. Fifth and the last step will be, whatever thoughts is coming in your mind, just those intrusive thoughts should be visualized as floating away. And if too many thoughts are coming at one point, then stop at that point and you can try it later. In this way, you can maintain your sleep yourself. But despite everything, you are still having difficulty, please meet psychiatrist for pharmacological therapy. Thank you.